Pradeep Pendiala, Professor of Anesthesiology. Wish you all a wonderful Monday. Today is 28th of November 22. Friends, today I am going to talk to you something related to laryngeal handshake. Have you heard of it? Laryngeal handshake? You keep doing handshake every day. Today I am going to tell about laryngeal handshake. You know, laryngeal handshake is conventional handshake technique which is performed with the non-dominant hand. Okay, if you are a right-hander, use your left hand. Identifying the hyoid bone and thyroid laminae and stabilizing the larynx between thumb and middle finger and moving down the neck to palpate the cricothyroid membrane with the index finger. So basically it is to locate the cricothyroid membrane with the index finger of the non-dominant hand, that is known as laryngeal handshake. Incidentally, during laryngeal handshake, instead of just using the distal part of the index finger, you can find cricothyroid membrane and you can also identify rhomboid shaped cartilaginous complex which comprises hyoid, thyroid and cricoid. All the three, that rhomboid shape. Okay, with your distal part of index finger, you can easily find out. Basically, why this is very important. Cricothyroid membrane is very important, especially in an emergency. Have you heard of cricothyroidotomy? It is an emergency procedure. Cricothyroidotomy is generally performed by making a vertical incision. Vertical, okay? Always remember, vertical on the skin of the throat, that is on the cricothyroid membrane, just below the laryngeal prominence, that is Adam's apple. Then making a horizontal incision. Then, after making the vertical incision, you can increase the width by making a horizontal incision in the cricothyroid membrane, which lies deep to this point. Okay, the cricothyroid membrane, it is also known as cricothyroid membrane or cricovocal membrane. Have you heard of cricovocal membrane? It's a ligament in the neck and it connects the cricoid cartilage to the thyroid cartilage. Prevents these cartilages from moving too far apart. It prevents. It is cut during the emergency cricothyroidotomy, which I just mentioned, to treat upper airway obstruction, that is during emergency. And do you know the difference between tracheostomy and cricothyroidotomy? Cricothyroidotomy is done slightly differently. A tracheostomy takes longer and is more difficult to perform. That is usually done by ENT specialists. Cricothyroidotomy can be done by anybody as an emergency procedure to establish an airway. When the person is dying without air and nothing is working out, you are not able to establish the airway with all sorts of attempts and all failures after multiple endotracheal intubation attempts. That is the last resort to be done. Okay. And it is a surgical procedure that is easier to perform, cricothyroidotomy. And it causes less bleeding because cricothyroid membrane is just punctured and it takes lesser time. The only absolute contraindication to cricothyroidotomy is age. But interestingly, we don't know exactly which is the correct defined age at which surgical cricothyroidotomy can be unsafe or when it is safely performed. This is a controversial topic. And the cricothyroid muscle is controlled by external branch of superior laryngeal nerve. This question is often asked during Viva. Which nerve supplies the cricothyroid muscle? Okay, and it increases the tension. This external branch of the superior laryngeal nerve increases the tension of the vocal cords during phonation, during speaking. Injury of external superior laryngeal nerve, but impair voice control, frequency, and your ability to sing. And because it tightens the vocal cords, it's directly connected. Damage to this nerve can cause an inability to retain high tones of voice, especially needed in singing, which I'm very fond of. You must have heard number of my songs. There are more than 3,000 songs on YouTube of mine. And this is a very dangerous thing. It can cause impaired pitch regulation and vocal weakness or fatigue. So you have to be very careful, because cricothyroid, if it is damaged, and this nerve, it is especially the external branch of superior laryngeal nerve is damaged. Thanks for patient listening. I hope you would know all these things when you are doing laryngeal handshake. Have a wonderful day. Bye bye. Take care.